Okay. I'm hoping a few others join. There's someone I wanted to join as well who has good insight on this. But Tosin, are you there?
Yeah, Samson, I'm here.
Okay. And I'm just waiting for Victor and Jocko to join in as well. Well, please be patient. Okay. No, we'll just kick off. Okay. Starting with the agenda items today. First thing is obviously there's a public acknowledgement that Black and minorities, ethnic groups are disproportionately higher or have higher occurrence of severe symptoms when they contact COVID-19. And we wanted to discuss that. So some of the things on the agenda items were what are the socio-economic factors that may be contributing to this. So for example, is it poverty, overcrowdedness? Why are BAME dying more, contacting more? Is it due to pre-existing health issues? And if it is, why do we have, why us? Why do we have pre-existing health issues? Especially hereditary. So for example, I'm asthmatic. Why? What are the cases? Is it pollutions and so on? So that's the first agenda item. Does anyone want to talk on that? If anyone wants to contribute, please do. Tosin, do you want to talk on that?
Yeah, hello, Samson. So, okay.
Yeah.
With the topic at hand, I think one should, I don't know where you'd want me to start from exactly, because
we start with the agenda.
We still think from what we have seen, the Black and Asian and ethnic minority community, like you said, have formed 30% of the deaths of COVID-19 in both America, and the figure in the UK is quite close. And interestingly, even from the medical point of view, so there's a lot of echo.
Guys, I'm sorry about
was a tragic and terrible milestone, and Stephen Powers, who was also there.
Can we just meet everybody?
I'm about to do that now.
Cool. Hello?
Sorry, Tosin. I'll mute.
Yeah, hello? You can
Sorry,
hear me,
Mr.
sir.
Yeah, go ahead, yeah.
So, with the issue at hand, like I was saying, almost a third of the population of people that have died from COVID-19 have either been Black or from Asian ethnic minority groups, although they don't form up to that percentage of the population in those particular areas. Interestingly, from the medical point of view, the doctors, almost 90% of the doctors that died from COVID-19 contact are actually either Black or from Asian ethnic minority groups. And interestingly, out of that population, I think another 90% of that population is actually Muslim as well, which was another highlight fact that was highlighted. So you raised a couple of points there. One was, could it be due to socioeconomic class? Wonder if anybody wants to shed light on that. But what we note is that maybe from even over here in America, the Black community especially tend to be in a position where their socioeconomic status is far lower, and they tend to suffer from more diseases and more illnesses, which can also be linked to the fact that they will not be they'll tend to be people that eat less healthy food, if you understand what I mean.
Mm.
And they are kind of exposed to things like getting underlying comorbidity, what we call comorbidities, other diseases like hypertension and diabetes and heart disease, particularly. For the doctors or the medics, particularly, and even for the Black and ethnic minority group, one factor has come up which is being researched at the moment, which is vitamin D. I don't know if anybody else has heard that, but that's what's trending now in the health sector, the issue of vitamin D deficiency.
Yeah, I'm having a meeting.
Yeah. Does anybody know about that?
Yeah,
So
it's
just
quite.
sorry to cut off. Just to say, Uche will be moderating with me. If she's online, please just feel free to join in whenever you're part of it. Okay, go ahead. Sorry.
Yeah, I was asking if anybody had also heard about the research on
Tosin, sorry
vitamin
to
D.
cut off. Can you just
Yeah.
introduce what you do as well, so people know your background? Apologies.
Hello, sorry.
Can you tell us what you do so we know your background?
Oh, okay. Sorry. So I'm a medical doctor. Working as a GP trainee at the moment. Obviously, I'm doing a hospital rotation, so I'm in the hospital at the moment, and we are seeing patients on the ward, some with COVID-19, some others with suspected, and others with normal stuff. I also do health coaching on the side, and what do you call it? I host a podcast and other things, which we can get into later. But for this main thing, I'm a medical doctor.
Okay. All right. Good. Someone else wanted to say something. Please feel free.
I think that was Victor.
Oh, Victor.
Hi,
Welcome.
how are you? Hi, from Samson. Yeah, I'm
Victor, sorry. Can you just introduce yourself, by the way?
My name is Victor Njoko. I'm a head of services for a non-for-profit health charity, really. And actually, one of the services I manage at the moment is running partnership with St. George's Hospital in Tooting. And like Tosin rightly said, some of my residents, some of the clients in the profession, we've had people with COVID-19, tested COVID-19. Unfortunately, we had few people passed on as well, both staff and residents. So it's really, I've had years of experience working both in public and private sector, in the healthcare sector. That's it briefly.
Okay. So what are your thoughts on the first agenda item? So the first agenda item we've mentioned is I'll read it again. Sorry about that. 1 second, just bringing it out. So just reading it. Okay. So what are the socioeconomic factors that may be contributing to this? So is it poverty? Is it overcrowding? Living conditions, etc. How do these influence spread the virus and severity of the disease? So what are your thoughts based on what you're seeing so far in the African community or the Black and Asian and ethnic community?
If I may add quickly, I think the fertility rate in the BAME community is about 30% higher than the normal. And like, again, from the research done so far, part of the reason is, again, our living conditions.
Victor, we're not hearing you well.
Can you guys hear me?
Yeah, so you're saying what?
Yeah, socioeconomic status, and
Victor, we're not hearing you. Okay.
Samson, I can hear him.
Okay.
We know in London and most of the big cities in the UK here, majority of the frontline staff members are usually from the BAME communities. And obviously exposure to the virus itself means that we are more predisposed to having it. So that's a very reasonable factor. And some of the living conditions in our community, we have people in more than one generations living together in the same household. So again, that is a possible reason why we have more fatalities in those communities. If I allude to what Tosin said when we just started, was about vitamin D. Obviously,